we're identifying certain aspects of the handout. You see that right here, that this would be the hood or prepuce, which covers the clitoris, okay? So again, where would the clitoris be? You see the tip or the glands of the clitoris right here. And we have other specimens to look at this in more detail, but this is the clitoris, the prepuce or the hood. And again, if we look deeper into the vestibule. Okay, so remember, the vestibule is a space between the inner lips, and you can readily identify the vaginal opening or the orifice, okay? And then if we move anterior to that, you see the opening of the urethra. So again, the urethra. And then surrounding the urethra, we have paraurethral glands. So really the glands themselves lie deeper in this tissue, and they happen to be in the anterior wall of the vagina. Okay, so again, you see the opening of these paraurethral glands or Skene's glands. So they would be at the anterior aspect of the vaginal orifice, and at the posterior aspect of the vaginal orifice, there are openings from the Bartholin's glands, which are also identified as greater vestibular glands, okay? So again, they're simply little holes or openings, and they're hard to identify, but again, the paraurethral glands are anterior, and the greater vestibular glands would be posterior to the vaginal orifice. All right, so you know, just to give you a perspective of this specimen, you see that again, right behind the pubic bone here, we have the presence of the bladder, and we have, of course, the uterus. And the uterus is basically anteroflexed. So it means it's tilted forward, okay? And now we're looking at the posterior aspect of the uterus. And obviously we see that we have associated with the uterus. And again, it happens to be wrapped in ligamentous tissue, but we have the oviducts, or again, the uterine tubes. And we're simply following these to the most distal end, and you see the presence of the infundibulum. Okay, so these are the fimbriae of the infundibulum, all right? And obviously they are paired, so we have one on the opposite side as well, okay? Now, look at the ligamentous tissues. So really, we're talking about the fact that we have the broad ligament here, and then where the ovaries would be attached to the actual uterus itself, we would have the ovarian ligaments. Okay, so again, the ovarian ligaments are attached to the uterus, and then the suspensory ligaments are further out. But we'll look at another specimen to identify these structures. So let's look at this isolated specimen, okay? And again, to give you an idea of what we're looking at, okay? So what I want to show you is that, once again, this would be a uterine tube. So here's the isthmus, right? Here is the ampulla, the infundibulum with the fimbriae, and this is the broad ligament here. Okay, so where we have the ovaries, so the ovaries are enmeshed in connective tissue. So where we have the ovaries attached are the ovarian ligaments, right? So we see an ovarian ligament right here. Here's my ovary. And at the distal portion, here is the suspensory ligament. And within the suspensory ligament, we have the ovarian artery and vein. Okay, so remember, these are basically going to be suspending or again, the ovaries from the pelvic wall. And these are the suspensory ligaments. Once again, here's the uterine tube, here is the ovary. Okay, it's quite a different perspective when you look at all the associated connective tissues. All right. Okay, so other details. I want to go back to looking at the underlying. Now remember what we just covered. Okay, we looked at really the female vulva. Okay, so the vulva is once again the external genitalia, and all the labia have been removed. And now we are looking at the underlying tissue right here. So people, once again, this would be the clitoris, and this is the body or the corpus of the clitoris. This is the glans or the tip of the clitoris, and it is analogous to the penis. It's a erectile tissue. It is corpus cavernosum. Now, these are the legs. So these would be identified as, like, they are each identified as a crus. Collectively, we would identify them as crura, okay? So again, all corpus cavernosum. Now, here are our vestibular bulbs, okay? So again, the vestibular bulbs are like brackets, like parentheses, okay, on either side of the vagina. So here is the opening to the vagina, okay? And here, again, I would describe it as being posterior to the clitoris would be the urethra. So here you get a very good view of the female urethra. It is significantly shorter than the male urethra, obviously. But again, you see that the urethra does not travel through any part of the clitoris, okay? So here is the clitoris. Posterior to that is the urethra. Posterior to that is the vagina, okay? So just to give you a perspective, remember the vestibular bulbs that form a parentheses on either side of the vaginal orifice, they are corpus spongiosum. So here are the vestibular bulbs. Now, let's look at an isolated uterus, okay? And once again, we've basically made a longitudinal cut in this structure. And this region is the cervix, right? We talked about the cervix. We talked about the fundus being the domed portion, and then the body, okay, which constitutes the vast majority of the uterus. And obviously this is the uterine cavity, right? Okay, so relative to the cervix, obviously you can see it's rather thick. It's several centimeters, okay, in length. And the initial opening into the cervical canal is the external os. Then we go down the cervical canal, which again we would harbor cervical mucus in this area, and then we have the internal os, or opening into what? The uterine cavity. Okay, so again, here is your cervical canal. And then I will show you another specimen that is helpful to identify these structures. So people, this is a uterus with the associated fallopian tubes, and this is a great view of the infundibulum and the fimbriae, okay, those little finger-like projections. Now again, this is the uterus, and you can see that we can identify the cervix right here, and that is the external os, the opening. Now, this is part of the vaginal canal. And remember, the vaginal canal basically goes around, wraps around the sides of the cervix. So this would be the fornix. Okay, we talk about these fornices that exist. So the fornix is the space between the vaginal wall and the cervix. So this is the fornix, okay? So it gives you a perspective. And then finally we have, okay, an isolated vagina. So it is a muscular tube, muscular elastic tube, and you see the rugae or the folds. Okay, so again, this is that muscular elastic canal, which is the vagina. And remember, this would more or less wrap around, right, and anchor to the sides of the cervix. So vagina and once again uterus, and here's the cervix. And let's look at some isolated ovaries. So people, these are isolated ovaries. The surface is that harder outer covering, the tunica albuginea. Okay, so that's what I'm pointing to. And I know these are ovaries isolated from a mature female, somebody who is beyond puberty, because they look bumpy. So these would be the developing follicles. Okay, so you see the bumps, again, on the surface of the ovaries.
The first term we'll identify is the scrotum. And the scrotum is more or less a pendulous sac that suspends the testes away from the body. So it is a dual chamber, and within one chamber we would have one spermatocord, one testis. And looking in more detail at the scrotum, you see that the skin would be, let's say, perhaps wrinkled or puckered if we were to contract the dartos muscle. So the dartos muscle is like part of really what we identify as the dartos fascia. So it is the smooth muscle directly underneath the scrotum, the skin of the scrotum. Okay, and you can see the surface of the scrotum is generally pigmented. There is sparse amounts of hair on the structure as well. Inside of the chamber, all right, it is covered in connective tissue, and really we're looking at inside of this chamber, inside of a single chamber, we're looking at a single testis attached via the spermatocord. So this whole structure is the spermatocord. Now, where does the spermatocord enter into the abdominal pelvic cavity? Well, we have this is the inguinal canal itself, okay? And the outer brim of this canal is the external inguinal ring. Okay, so what I'm pointing to is the ring, external inguinal ring. If I went deeper into the inguinal canal, on the other side of this canal, entering into the abdominal pelvic cavity, would be the internal inguinal ring. Okay, so that is what we're referencing when we talk about those rings. Now, again, if we come back to the spermatocord, all right, I'm just walking down our list of terms. There is the presence of skeletal muscles. So there's this cremaster muscle. So in response to cold temperatures, let's say entering into a cold swimming pool, that cremaster muscle can retract the testes, okay? That spermatocord up further into the inguinal canal and bring the testis against the body within the scrotum, Okay, so again, that helps to regulate the temperature of the testis. Now, once again, if I actually go back to briefly talking about the scrotum, the dartos muscle that causes the puckering, that causes the wrinkling of the scrotum itself, well, that would contract. This is smooth muscle, this is skeletal muscle, but this smooth muscle would also contract in response to cold temperatures or a cold environment. And again, basically, the whole entire pendulous sac would tighten up, pucker up, and bring both testes closer to the abdominal wall. Okay. So again, walking down our list of terms, this would be the testis, right, singular. And you can see the presence of the epididymis, this coiled tube, right? So really, when we're considering a testis, inside of the testis, if you recall, there are a plethora of seminiferous tubules, okay? And remember, this tunica albuginea is this, like the harder outer layer of the testis, and it invaginates and basically forms septa, right? And then in each one of those lobules, you would harbor 1 to 3 seminiferous tubules. Then we leave the testis, right? Eventually entering into the epididymis here. And let's use this specimen. So this is the head of the epididymis, the body, and then at the tail, the epididymis will basically curve back upon itself, okay, and eventually straighten out to form the vas deferens. Within the spermatocord, there are testicular arteries, veins, lymphatics, nerves. All of these are harbored in the spermatocord. All right. And let's see. So what we're now looking at, okay, would be the male bladder, all right? And we are looking at the posterior aspect of the male bladder, okay? Now, what we want to identify are these seminal vesicles, okay? So they produce seminal fluid, and they will combine with the ampulla right here of the vas deferens within the prostate gland itself. And the ejaculatory duct would be inside of the prostate, and the ejaculatory duct on either side enter into the prostatic urethra. So the prostatic urethra runs through the prostate gland. This is the prostate gland. This is the membranous urethra, which would travel through the pelvic floor and eventually into the penile urethra. So here we have the connective, erectile tissue, okay, of the penis isolated. And you see that traveling through the corpus spongiosum, this would be the penile urethra, okay? And if you recall, in lecture or in our laboratory PowerPoint, we talked about various aspects of the corpus spongiosum versus the cavernosum, all right? So, as you recall, if I look at, again, this specimen, a transverse cut through the penis, you see this is the corpus spongiosum, and we have those 2 counts of corpus cavernosum, all right? But again, if you look at the longitudinal cut, this would be the corpus spongiosum where the urethra is traveling, and then you have the two columns of corpus cavernosum, all right? And then identifying certain aspects of the corpus spongiosum. So this is the glands, right, of the corpus spongiosum. And once again, just going down our handout, we have the pedicle, okay, which is the long portion where, that long column where the penile urethra travels, and then you have the bulb, okay? So again, the bulb. And now we're going to look at the corpus cavernosum. So you have two columns of corpus cavernosum. And once again, if we identify these components, there is the scapus, which is the long portion of the corpus cavernosum, the scapus, or also identified as the corpus, and then you have the arms, okay? And the arms are identified as the crus. So this would be the right crus and the left crus, or crura.